Medications that make you diabetic or make diabetes worse. Beware. Have you ever been taking medications for a while and then all of a sudden your blood glucose levels were higher than normal? Well, this could be because some medicines can cause this. Hi, I'm Dr. Ahmet Ergin. I'm an endocrinologist and a diabetes specialist. Today we are talking about meds that can give you diabetes. Sometimes diabetes might go away on its own, but in some cases it doesn't, which means that if we don't stop giving these type of pills or injections soon enough, permanent diabetes may result. So today I will explain how each medication type can cause diabetes. Now, if you must continue taking the medication that caused your diabetes, it may make your controlling your diabetes more difficult than normal. So if you're able to discontinue the medication, your blood glucose levels may become a lot easier to manage. Now, of course, following a healthy diet and meeting the recommended exercise guidelines will help you manage your blood levels much better if worse comes to worse, right? And we have to also reduce the risk of diabetes and high blood sugar levels by taking the medication in lesser dosages if possible or for a shorter length of time. You may be prescribed a lower dose of medication in an effort to prevent issues like diabetes from arising, hopefully, but if not, talk to your doctor. If you have a higher chance of acquiring type 2 diabetes, you may want to talk to your doctor about that, how that medication or dosage may actually increase your risk of developing diabetes, like steroids, for example. So we're going to talk about that first. Corticosteroids are really potent class of drugs that are used to treat a variety of illnesses because of inflammation like rheumatoid arthritis, it could be lupus, there's many other diseases. Now, steroids can be in the form of creams, inhalers, pills, infusions, or injections, so it is possible that corticosteroids will actually cause an increase in blood glucose levels even without diabetes, which will then return to normal after the steroid therapy is completed. However, particularly if corticosteroids are used for a prolonged amount of time, steroid treatment can sometimes result in the development of type 2 diabetes that is irreversible in some cases. So if you are already a diabetic, it is very possible that you will need to take insulin while taking steroid medication because high-dose steroids such as the one to treat COPD or knee injections will skyrocket your blood sugar. Now, following the completion of your steroid course of treatment, you may be able to switch to a less potent diabetic prescription or even discontinue your blood glucose lowering medication completely. Now, we're going to talk about the beta blockers next, such as atenolol, carvedilol, metoprolol, and so forth. In order to lower blood pressure and heart rate, beta blockers work by inhibiting the release of adrenaline and noradrenaline from the body. Now, patients with an angina, heart disease, or high blood pressure, they may be prescribed beta blockers to help them manage their symptoms. Now, beta blockers, on the other hand, can impair the insulin sensitivity. They can increase the likelihood of developing type 2 diabetes, especially in the long term. The next is thiazide diuretics, such as hydrochlorothiazide. These are medicines that help the body flush the water out of the body. They're called diuretics, thiazide diuretics, etc. Some people call them water tablets. They can be used to lower the blood pressure or remove the extra water from the body. They can also be used to help lose weight and so forth, but the side effects of taking thiazide diuretics is a lot. One of them is high blood sugar levels, and you can have low levels of salt in your body, like sodium levels can go down. So magnesium and potassium can go down as well. If you stop taking thiazide diuretics, your blood sugar actually may, but not always, go back to normal. Next is cholesterol medication, statins. Now, before we get into that, if you're enjoying this video and learning something, please click on the thumbs up, subscribe, and share the content. Let's go back to our topic. Statins are a class of drugs that are commonly used to treat high cholesterol, as you must know. They work by inhibiting the enzyme HMG-CoA reductase, which is required for body to produce cholesterol. Now, statins were first introduced in 2003, and they have since been prescribed to millions and millions of people around the world. In 2011, a study published in JAMA Medical Journal showed a link between taking higher doses of statin medications and a higher risk of type 2 diabetes. This finding led to FDA, the US Food and Drug Administration, introducing warnings on statins in 2012 advising on the high risk of blood glucose levels and memory problems associated with the medication. While statins are still widely prescribed, it is important to be aware of the potential risks that are associated. Next on my list is antipsychotics. Antipsychotics are a type of medication that are used to treat schizophrenia and other mental health conditions. While they can be effective in managing symptoms, they can also have some potential side effects like weight gain. They're actually horrible with the weight gain, and blood sugar levels as a result will go up. So if you're taking antipsychotics, it is important to monitor your weight and blood sugar levels very closely. If you experience any significant changes, speak to your doctor about adjusting your dosage or discontinuing the medication. Now, while these antipsychotics may cause temporary side effects, if they are taken for an extended amount of time, some of the effects such as diabetes may become permanent. So therefore, it is really important to weigh the risks and the benefits of taking these antipsychotics before starting a new medication regimen. The most dangerous atypical antipsychotics for diabetes are thorazine, clozapine, olanzapine, risperidone, and quetiapine these are atypical antipsychotics with a moderate risk of diabetes. Now, some of them are like called Seroquel. Some antipsychotics are low risk for diabetes, such as Abilify or aripiprazole or ziprasidone, etc. Last on my list is birth control pills. They do not necessarily cause diabetes, but will definitely make you more insulin resistant. And if you already have diabetes, your blood sugar actually may go up after starting birth control pills. So that's it. If you think this video helped you, make sure you subscribe. That will prevent missing any of our videos that is published 3 times a week. Stay happy, stay healthy. You will see you in the next video. Hey guys, I hope you're enjoying this channel so far, and I hope you subscribed already. If you didn't, do it. And if you did, watch this video right there. I think that will help you too.